Hello, my name is Emee and welcome to part 3 of this webcast on qualitative research and social impact. What can we learn from action research? In this section, we are going to talk about the importance of developing partnerships and also the relevance of disseminating your work as widely as you can. Now, when we talk about partnerships, we should never ever underestimate the importance of forming these partnerships. And when we mean by partnerships, I mean trying to form interdisciplinary teams and moving beyond the confines of academic circles and engaging with wider stakeholders. Now, this is something that I've been trying to do in my own research and practice. For example, with my work with the AITA community, I work very closely with the leaders in that community and the residents in that community. But I also engaged with non-governmental organizations such as the Popular Education for People's Empowerment, the Development Action for Grassroots Learning, and also government units such as the Barangay Council, the Department of Education, and the National Commission on Indigenous Peoples. Our role really as community and critical health psychologists was just to facilitate discussion and facilitate meetings and bring all of these people together so we can think about the important issues on the ground and think together what we can do to address these. That's what I've done in the Philippines, but this is also something that I try to practice with my health literacy work here in the UK. Currently, I'm working very closely with the Stoke-on-Trent City Council on trying to promote health literacy in the area. We initially started with a project on health literacy and improving the health literacy levels of South Asian men and young men with diabetes. We used qualitative research in order to look at the experiences of managing diabetes of these target groups and work closely with Stoke-on-Trent City Council on how to improve their experiences of managing diabetes and how to improve their health literacy levels as well. This project continued to grow, and because we recognized that we didn't really have baseline health literacy data in the area, we suggested to also have a health literacy survey in Stoke-on-Trent so we could actually understand the current health literacy level in the community and see how we could improve it if it needed some improving. So we've done that. We looked at the health literacy of patients, but we also looked at the readability of the information that is available out there. So it's not just a one-way process. As we are trying to improve the health literacy of the population, we are also trying to improve the readability of the information and making sure that the reading level needed to read and understand this information is in line with the current health literacy level of its target audience. So this is what we've been doing in Stoke-on-Trent. This partnership is continuing to grow and to blossom. We have several activities in line, and we've already recently developed the health literacy strategy in Stoke-on-Trent so we could improve the health literacy of not just the patients but also the healthcare providers and the health literacy of the environment as a whole. So that's what we have done at a local level. We tried to link with relevant stakeholders, but on a national level, I also work very closely with the Health Literacy UK, wherein we try to engage with patients and patient groups, healthcare practitioners and providers, teachers, policymakers, non-government organizations, and academics so we can all work together to discuss and develop new research ideas. We try to run projects together, write research reports and papers, and also think of ways on how we could implement our research and integrate these into practice and policy. So we have this advocacy work on a national level as well through Health Literacy UK. And the point that I'm trying to make here is that for us to really make an impact, it is important that we are able to form and develop partnerships not just within academia but really trying to extend our engagement widely. we need to be able to engage and develop partnerships with groups that can actually make real and sustainable changes on the ground. And this is something that I'm consciously trying to inject in my own research and practice. Now, apart from that, it is also important that we are able to share our work as widely as we can. Don't keep your research and your work to yourself. Disseminate it as widely as you can. It is good to have publications, and it is also good to share our research at conferences, but these are not enough. We should actually try to share our work with those who can benefit from it and also can do something with our research findings and recommendations. And this is something that I have been trying to do right from the start. For example, I still remember when I just had my first publication, and it was way back during my MSc years. At this point, as a qualitative researcher, I did some discourse analysis of the ILO Convention 182 on the worst forms of child labor. And this particular convention aimed to address the detrimental consequences of child labor to children's health and well-being. And it aims to address it immediately by eliminating its worst forms. Now, from the discourse analysis, we suggested that it actually used an organizational discourse, and although it tried to promote the elimination of the worst forms of child labor, it also tries to maintain the existing hierarchies of power because it emphasizes legislative structures and consultation with the organization of employers and workers. They have positioned the children and the families on a passive level, and it is important that they are more active in this process, and we recommended that the convention be revised and let the children take a more active role in this process. Well, this was the idea, that was the publication. However, I actually didn't stop there. I wanted to share this work with those who actually have the power to take these recommendations on board. So what I did, I wrote to several government officials in the UK. So for example, I wrote to the office of Tony Blair at that time, who was the Prime Minister at that time, to DFID, and I also wrote to the senators in my country, the Philippines, to the Department of Social Welfare and Development, to the Department of Labor and Employment, and so on. I also attended some ILO meetings to express some of my concerns, and I really wanted to advocate and give the children a more active role in the process of eliminating the worst forms of child labor. So what did I get? In the UK, what I got was a letter from Tony Blair's office to acknowledge that they have received my letter. That's all that I've got. But to be fair, the response that I received in the Philippines was more elaborate. They basically gave me a detailed letter to explain what the government has been doing to eliminate the worst forms of child labor. And I was actually quite happy about that. They reassured me that they are doing the best that they can, and they gave me a list of activities and people who are involved in these activities to ensure that the action plans to eliminate the worst forms of child labor are in place. So that's what I've done. I got on with my studies and continued with my training and move on. But 5 years down the line, this activist side of me was reignited. And this time, it was ignited by this TV show called Harry and Paul. In 2008, the BBC aired this clip wherein a Filipino maid was portrayed as a sex slave.
Wally Post here, I'll take that.
What, sure? What's going on here?
Not a lot, I'm afraid. Our chums up the road wanted to see if we could mate their Filipino maid with our northerner, but he's not having any on.
Mr. Sexy.
Come on, Clyde, mount her. You, present your rear. Have I got in now, please, Mr. Lovelock?
All right, then, go in, you useless bloody northerner. You go home. Go on. Scram! See you tomorrow.
As a Filipino myself, I was absolutely offended when I first saw this clip, and what followed next was a series of initiatives and activities that involve the Filipino community in London and in the Philippine Embassy in London. We demanded for a public apology from the BBC and the producers of the show Tiger Aspect Productions for inciting stereotyped racial discrimination, vulgarity, and violation of human rights. We also launched an online petition and staged public protests in London. In the end, we actually did receive the apology, and here's the video clip to show you.
We understand that a large number of viewers have been concerned by the depiction of a Filipino woman featured in an episode of Harry and Paul, a series we produced for BBC One. Firstly, we are absolutely sorry for anyone who's in any way offended by the programme. That wasn't our intention. The sketch in question, like the majority of Harry and Paul's work, clearly represents a preposterous situation. The comedy here, as in many other sketches in the series, is aimed at the appalling insensitivity of the British upper class, here represented by Enfield's character, rather than those characters played by Paul Whitehouse and the Filipino woman. Harry and Paul is a post-watershed comedy sketch show well known for its exaggerated humour and absurd characters. It in no way represents real people and was never intended to offend or demean any viewer. It is our policy to work at all times in accordance with the requirements as set out by the broadcasters we supply. This was certainly the case throughout the entire production period for the series of Harry and Paul. The BBC was editorially happy with the show and was across all decisions taken and made this clear in its response to a letter dated 3rd of October to the ambassador at the Embassy of the Philippines. We certainly did not set out to intend to offend anybody. We absolutely recognise that there was a section of the Filipino community who were offended, and to them we apologise for any offence taken.
Thank you, Andrew. Thank you.
Oh, Andrew Zane, Chairman of Tiger, Chief Executive of Tiger Aspect.
Thanks, Andrew.
Thank you, sir.
All right.
After this, as an academic, I also wrote an editorial in the Journal of Health Psychology, which actually attracted an open peer commentary as well from other health psychologists. So this is actually trying to engage the academics as well in this public debate and got some insights from the critical health psychologists as well. So the main point that I'm trying to make here really is if we want to make an impact, we need to share our work and advocacy more widely. If needed, we need to involve the media. And going back to my points earlier, first, make sure that we have enough evidence to support our claims. Second, to engage relevant stakeholders. And third, to develop working partnerships with those who can really make things happen. In this case, we had enough evidence through the petition that sections of our community found the clip to be offensive. Second, we worked with several Filipino organizations in the UK to push forward this advocacy. And finally, we really worked closely with the Philippine Embassy in London to give this campaign the extra push that it needed.